Concludes questions to the Minister for Infrastructure. You move to questions to the Minister of Health. I call Peter Martin.
Question 1.
Minister.
I thank the member for his question. Given the logistics, there was no consideration given to asking the South Eastern Health and Social Care Trust to reopen the inpatient ward or minor injuries unit at Bangor Community Hospital. I believe the member is aware that service, along with the associated resources, transferred to the Ulster Hospital as early as September 2023, and that was following extensive consultation. And as detailed in the consultation report, the standalone minor injuries services at Bangor Hospital were not sustainable, and I believe since then there has been a physical reconfiguration of that area within Bangor Community Hospital. As the member will know, to provide a new service, a step-down service, an emergency service, we need 4 things. We need the building, we need equipment, we need medicines, and we need the workforce. And the workforce, of course, is the most important element. If you don't have the right workforce, it doesn't matter what buildings or what capacity in terms of equipment or what range of medicines you have. And given the timescales, it was not possible to consider Bangor Community Hospital in the way in which he has suggested.
Mr. Martin.
I want to thank the Minister for the answer that he's given there, and he touched very much on workforce. GPs are one of the front lines in terms of dealing with patients before they get to ED. Could I therefore ask the Minister for his plan to increase the number of GPs being trained in Northern Ireland and a possible timescale to achieve this?
Well, I thank the member for his follow-up. I mean, increasing the number is something that we have been doing over recent years. Would I like to increase it yet further? Yes, of course I would. Would I like to provide a timescale? Yes, I would. But the fact is that the budget does not permit me to start detailing that sort of plan to the member, because as we move into next year's budget for 25-26, the draft leaves the Department of Health with a funding gap of around £400 million. In the current year, I would remind the member, I'm still working hard to try and deliver the pay parity awards that are deserved by both nurses and doctors. So I don't want to sound the irony klaxon just yet, but these are challenges that cannot be met in terms of increasing staffing, workforce and resource without an appropriate budget accompanying it.
Full utilisation of facilities such as Bangor Community Hospital and indeed the Down Hospital help to alleviate pressures that are felt right across the South Eastern Trust? And would the Minister agree that more could be done to utilise the Down Hospital, including its urgent care centre, by maybe extending the hours, or indeed some of the provisions within the hospital to assist people not having to travel to the Ulster Hospital to get it and save some of the pressures there?
Well, I was in the Down Hospital recently, and the urgent care centre was one of the areas that I visited. I think it's a magnificent development. And indeed, one of the points that was being made to me by the consultants and the nurses within that urgent care centre was, in the past, people who are living in the vicinity of that hospital are making their way to the Ulster Hospital emergency department to be triaged and then referred back to the Down Hospital. So the whole kind of direction of travel that I want to see, and which is emerging, is that you have direct referrals, preferably by GPs who are doing a triage assessment, and then being able to contact an urgent care centre directly and bypass EDs, bypass those unnecessary trips to other hospitals. More broadly, in terms of maximising the capacity of these hospitals, absolutely, I'm with my predecessor, Robin Swan, who said that he needed every square, I would imagine, yard, because he's not a European and wouldn't have gone for every square metre. But we need every square yard, every square metre of all the facilities, and it's how we reconfigure them, which is why I'm out to consultation on that idea of having a network of hospitals, which is an idea we really need to embed in the population's minds.
Question 2 is withdrawn. Michelle McElveen.
I thank the member for her question. Following the publication of the consultation report, the Social Care Collaborative Forum was established, and that's with the intention of working with my department to implement the proposed reforms. Now, the forum provides the cross-sectoral leadership which is going to be critical to adult social care reform. And while it's expected that full reform of the scale necessary will only be deliverable in the longer term, we're also trying to make progress in a number of key areas. Achievements to date include the establishment of the Fair Work Forum, which aims to gather evidence to support additional investment in the sector, also to make it a real living wage sector, which is a policy the member will be aware I announced earlier this month. I also made available additional funding in financial year 24-25. This is to help stabilise and to maintain independent sector provision. The implementation of Careline Live in 3 of the health trusts is enabling the better utilisation and deployment of the Trust's home care services. They do this by creating greater line of sight of home care capacity on specific schedules and quickly identifying areas where there are capacity issues and where recruitment activity needs to be focused. The completion of a review of the impact of Trust's early review teams has resulted in 2,884 SPPG-funded hours per week being recycled back into the system, and that was between October 2023 and September 24. It's intended to roll out reviews across all programmes of care in the next financial year. A new social care workforce strategy launched on the 12th of December, and among other things it sets out how we'll attract, grow, retain and develop the skilled staff necessary to deliver high-quality social care. And to deliver that stronger strategic vision, a whole systems approach to design and delivery will be required.
Ms McElwain.
Thank you, Mr. Speaker, and to thank the Minister for his response. And obviously, the overall reform of adult social care is essential to the transformation of the health service, and I accept that it will take a considerable period of time. What is equally essential is to take measures to ensure the flow of patients in hospitals, and what we're currently seeing is unacceptable, and I appreciate that he has outlined some things that he's doing, but can he perhaps give us some confidence that what is happening now will have an immediate consequence?
Well, I can assure the member that there will be an immediate consequence in terms of what I'm calling a blank sheet planning for next winter, and indeed earlier than that. As she correctly identifies, the issue has been the flow, and the flow can be blocked at any point between arriving in an ambulance at an acute hospital and being fit for discharge at the so-called back door. And the member is aware that this year the biggest problem which has manifested itself in emergency departments is not the emergency departments, it is the community capacity, and I'm determined to work at that over the course of the coming calendar and financial year. And I think introducing the real living wage should make working in that area much more, hopefully much more attractive, certainly more attractive. I think that's a major step. And with that blank sheet approach to pressures within our EDs, not just winter pressures, which I now call additional winter pressures, I would hope that we would look at the consequences and how we improve going forward.
Ms Gibbons.
Minister for his answer so far, and I really do welcome the commitment to the real living wage. I do think this will go some way to tackling this issue. Minister, in relation to that, as you've said this yourself, we are very aware that social care is key to unlocking some of the significant pressures on our hospitals. And from speaking to some providers, there are solutions that could be looked at. Has the Minister looked at potentially ring fencing funds around rural packages, which would help to tackle some of the real challenges in getting care packages for people living in more rural areas that are harder to reach and aren't as attractive, I suppose, for domiciliary care providers, given the huge travel times and difficulties accessing those locations?
Yes, and I thank the Chair of the Committee, obviously speaking in a personal capacity or an MLA capacity. Yes, that is an issue, but it's one of a range of issues that I think we'll have to look at. And again, I think we have to think outside the box, have that kind of blank page start and say, what have we got? What are the issues, first of all? And there are specific rural issues with healthcare delivery, absolutely. And then we say to ourselves, well, what are our resources and what is our ability to meet the challenges that we have? And I'm more than happy to work with the member on an individual basis. I'm more than happy to work with the committee, and I will be working with officials. I'm very glad to listen to representatives from the voluntary and community sector who operate in rural areas to fully understand myself, to fully understand the issues, and to listen to imaginative ideas for how to address them.
Justin McNulty.
Concordia, Minister, you mentioned a blank sheet approach in relation to Dealing with adult social care challenges, what would you say to the frontline workers in our care homes who have come to your department with practical, logical and workable solutions, but who have said they are not being listened to? Do you agree that many of the issues in social care are not a lack of money, not caused by a lack of money, but caused by how money is being spent, and how vital it is, Minister, to listen to those people who have their finger literally on the pulse?
Well, I think, first of all, what I can agree with the member on is listening is absolutely important. And I believe that's what I do as the Minister of Health. I listen to people, not just in the department. I listen to anecdotes, but more importantly, I like to listen to people who are at, to use that old-fashioned phrase, the cold face, and I do that all the time. I was in a care home actually on Christmas morning, listening to some of the staff talking about the challenges they have in delivering for their service users. So yeah, it is really, really important to listen. And it's important to set a direction of travel, and I think the member will recognise that I have set a direction of travel, and that is to shift left, to try and take the emphasis off curing people who have become, in many cases, acutely ill and need an acute hospital, and get the emphasis into community care, into primary care, into social care, into prevention and into early intervention, and making sure that people do not need to go to an acute hospital unless that need is, as I say, absolutely acute.
Paula Bradshaw.
Thank you, Mr. Speaker. You mentioned there about the Fair Work Forum. So I have a constituent who had to take some time off work because she picked up a bug in the nursing home, but she wasn't paid for the shifts that she missed. What is being done to actually improve the terms and conditions for our care assistants, domestics, etc., who are providing vital support within our care homes? Thank you.
Well, I thank the member for the point, but I'm not aware of that individual constituent's contractual relationship with her employer. It may well be a private sector matter, in which case the department is probably limited to the extent to which it can intervene. But if the member wants to provide me with the details, I'm more than happy to look at it and to see not just to look at the particulars, but sometimes, as Shakespeare says, from the particular comes the general.
Stuart.
Thank you, Mr. Speaker. Mr. Speaker, once again shone a spotlight on the importance of our social care workforce. I therefore very much welcome the Minister's recent announcement that he will ensure the sector becomes a living wage employer. Can the Minister provide an update on some of what else has been achieved to date to support our social care workforce?
Minister.
Yes, indeed. Thank you to the member. There are a range of initiatives underway to help build and sustain that workforce. I've already referenced the social care workforce strategy. That will be key to addressing recruitment and retention within that sector. The launch of the new Level 2 Safe and Effective Care Practice Certificate and a new care and practice framework, which includes career pathways, and a continuous learning framework. These will all support the career progression of social care practitioners, and as a result it should enable them to use their practice experience, their knowledge and their skills to better support service users. Now, I've also mentioned the establishment of the Fair Work Forum to make an evidence-based case for improving pay, terms and conditions, and I recently announced my intention, as I say, to make the sector a real living wage sector. We've also sought to better promote social care as a valuable career choice. We've delivered the Social Care Making a Difference promotional campaign, and that showcases the value and the diversity of social care.
And Dodds.
Number 4.
Minister.
I thank the member for her question. I've asked my officials to identify the key lessons from the new maternity hospital and ensure these are applied ahead of signing any contract for the new children's hospital at the Royal Victoria. My officials are working closely with all parties involved in the delivery of the new children's hospital. That includes the Belfast Health and Social Care Trust, the design team and the contractor. And we want them to consider a range of improvements to the management of this construction project, which the member and I think, agree is absolutely crucial. At a minimum, what I'm looking for is the use of an NEC form. That's a new engineering contract form of construction contract, which contains contractual requirements demanding timely decision-making with collaborative agreed outcomes. I also want the appointment of a new Director of Strategic Development within the Trust, with a role to carry out the role of senior responsible owner for the Children's Hospital, much of the workload will be attributable to the project. The incorporation of learning from the maternity hospital and other learning from recent major schemes in the NHS and indeed in Dublin into the design and commissioning arrangements for the children's project will be essential. And this has included the definition of more detailed criteria for the water safety standards. We'll also see the engagement of independent subject matter experts for all the critical systems. That includes high voltage and low voltage electricity, water, fire, medical gas and ventilation. And the introduction of building information management and a contract management software system with common data environment for use by all parties will improve project collaboration and coordination. And finally, the introduction of a new change control protocol for the Children's Hospital project should be reassuring.
Mrs. Dodds.
Thank you, and I want to say thank you to the Minister. I absolutely agree with him that the new Children's Hospital is an imperative for us here in Northern Ireland. I spent many years of my life in the old Children's Hospital, and the conditions there have not improved significantly since that time. In a reply to a question that I had written to him earlier, I received a reply just this morning to say that consultancy fees for the Children's Hospital is in the region of £25 million so far. Could the Minister explain what this amount of money was spent on and how we might prevent excessive, if that isn't excessive, amounts of money on this element of the bill?
Well, I thank the member for her supplementary question, and I acknowledge, of course, the time that she spent in previous years in the maternity hospital. I'm not going to endorse the thought of these fees being excessive, because I think to reach that conclusion we need to break them down and analyse them line by line, and that is something that I have asked be done, because like her I find the amount is surprising, if I use that phrase, surprisingly high. But these are major works which have gone over a long period of time, and I've said in the House before, I don't think it's just construction of new build within health and social care that should be an issue for this House and for the Executive. You know, you think of things like the additional costs of Ulster University's development in North Belfast. You think of Casement Park. I have come to the conclusion that we are certainly not top of the class or best in class when it comes to major infrastructure works. And this is, I think, part of a bigger problem that does need to be analysed, it needs to be looked at, because these figures, on the face of it, are surprisingly high. And I think it is incumbent upon me, as the Minister for Health, to try and look and see if it can be fully justified, or whether there are areas where there are learnings where we can say, you know, really we shouldn't have run up such a big bill.
Donny Donnelly.
Mr. Speaker, thank the Minister for his answers so far. These projects are associated with spiralling costs and ever-increasing delivery timelines. Can I ask the Minister what he's doing to ensure that future projects are delivered on budget and on time?
I thank the member for his question, and I agree with the sentiment of it, although I caveat that by saying there are things that are beyond our control. You know, the rise in building costs, the rise in building materials has been much higher than I think anybody, any economist, any politician, any Chancellor of the Exchequer could have predicted over the last number of years. That said, I think we have to think again, because there are so many examples, as I've just said previously, not just in health provision, where the costs and the timelines are exceeded in quite stark manner. I think it was the Audit Office who recommended that we have a sort of executive-wide body that looked at all these major projects. I think that is the right way to go. And I had previously written to the First Minister and the Deputy First Minister in those terms. I think it is an issue that, to my mind, is unresolved, because I don't know whether that is going to be the outcome or whether there's even a better outcome being proposed by colleagues in the Executive or elsewhere. But how can anybody who has listened to the history of these major projects over recent years have any confidence that the next project will not run over in time and in cost? I thank the member. I want to assure the member work on the proposed changes to the legislation is a key focus for my department, and I am committed to ensuring that the work is completed without undue delay. And I believe the member may well come back to me and say there has already been undue delay, and I think he can make that argument, which I am more than happy to listen to. But I would say, in defence of the department, it's a complex area. It's not the case that in GB all universal credit recipients are automatically eligible for help with their health costs. So that needs to be looked at, and that's part of the delay. But I'm pleased to tell the member I'm announcing the public consultation on the proposed eligibility criteria for passporting UC recipients has launched as of today. And this consultation will run for 6 weeks, with the associated legislative process commencing thereafter. It's intended the legislative process will be completed by this summer, and my aim is to ensure that those most in need automatically receive help to access these very important health services.
Mr. Allen.
Thank you, Mr. Speaker, and can I thank the Minister for this important update. And Minister, will you commit to assessing whether the length of time it's taken to get to this juncture can be justified? I don't feel that it can. And indeed, can you outline what engagement your department has had with the Department for Communities around streamlining the application process for those who will not be captured by any legislative change?
Well, I thank the member. I think there are three things now that the member is bringing up. First of all, let's make it happen. And to my mind, that is the single most important thing. That we look after these vulnerable people and make sure they get the help and the resource and the funding support that they need. Secondly, of taking it in reverse order, yes, there's been ongoing consultation between officials from my department and the Department of Communities, and I think the two departments work well together, and actually I evidence what has been happening since last week's storm as evidence of good cooperation from ministerial level down between myself and the Minister in the Department for Communities, because a lot of the vulnerabilities, just to diverge for a moment, are not with people in hospitals or care homes, it's the vulnerable in the community. But then the third point that the member raises is, will I investigate whether there has been an undue delay? I give the member an assurance I will do that, but let's get the thing fixed first.
Carl.
Minister, leaving aside the obvious fact that nobody should be forced to pay for healthcare, can you confirm why exemptions don't automatically apply when people sign on to universal credit or other benefits? And can you confirm why people have to annually apply for the HC1 form? Because I fear that too many people are falling through the cracks.
Sir.
I will confirm that this to the member in writing, but it's my belief that these are regulations coming out of the UK government and are UK-wide.
Thank you, Mr. Speaker, and thank you, Ministers. I'm delighted to hear that the consultation has been launched, and the quicker we can get this sorted, the better. I'm just wondering what engagement you've had with DWP in terms of who are those that are excluded in GB, and whether it'll be a direct copy and paste, basically.
Yes, I maybe should have made clear by now that my officials aren't just liaising with the Department of Communities here in Northern Ireland, but also the Department of Work and Pensions in London. This is, as I said, a complex area, and it is our intention to get the best possible fit for people here in Northern Ireland, and that involves knowing exactly what DWP are doing, including the restrictions they put, because, as I say, not everybody automatically passports from universal credit to get this help. So we want to get the best of both worlds.
William Irwin. Speaker, question number 6. Minister.
Yes, I thank the member. I recognise, like elsewhere in the United Kingdom, our health and social care system as a whole is under sustained and significant pressure. Too many people wait too long to access urgent and emergency care. This falls short of the service that we all strive to provide. So my department recognises the risk of possible harm to patients who experience long waiting times in an emergency department. Some patients will present with a range of issues where alcohol may have been a factor, for example with a fracture or a head injury due to a fall, or they may present with symptoms of liver disease. Hospital attendances are coded to reflect the primary reason for a patient attending the emergency department. But this won't necessarily reflect the fact that alcohol was a contributory factor. Therefore, it is not possible to provide a reliable assessment of the impact of excessive alcohol consumption on visits to emergency facilities over Christmas and the New Year. We do know our EDs faced increased pressures over the festive period. That's why my department asked the trusts and the ambulance service to develop improved plans to maximise capacity and improve flow through our hospitals, all part of the winter preparedness arrangements. Trust plan also to include the development of pathways that provide direct access for ambulance services to services as an alternative to conveyance to ED departments, which will reduce pressures on emergency departments. And Mr. Speaker, if I may so bold, maybe I could ask the member himself a question. Does he support me in my drive to try and get the Executive to agree to introduce minimum unit pricing for alcohol? This has proven to decrease demand on the NHS in Scotland.
Mr. Irwin.
Thank you, and thank the Minister for his response. I mean, I don't take alcohol myself, so I had a constituent approach me about Craigavon Area Hospital, where he's seen firsthand the issue of excess alcohol and the dangers it creates to some of the staff. Does the Minister not accept that this is an issue and needs to be dealt with? Sir.
Well, I thank the member for his follow-up question. Before I became Minister, in fact, we're talking maybe 3-4 years ago, I was made aware that Monday nights are the nights when EDs are under the most pressure. And so as a constituency MLA, I asked to spend the night observing a night shift in the ED at the Ulster Hospital. And I brought up the question of people coming in with excessive drink and that being a problem and a pressure. And the nurses were very clear about this. They said absolutely not, because we've been dealing with this for years and for decades. It's not a new issue. It's one we're well used to dealing with. The big problem, by the way, they said, was mental health patients, because in the old ED at the Ulster Hospital, there was only one side room for mental health patients. So when the second one presented, there was nowhere to put them. But they said you miss. A guy had come in around midnight, maybe a bit after midnight, by ambulance, and he was drunk. He had a lot of alcohol on board. They found him a chair, and at around 2 o'clock in the morning, the chair was empty. And I said, well, you know, have you dealt with this patient? And they went, oh, no, he's disappeared. And then at about 3:30, a second ambulance brought the same patient back. And what had happened in the meantime? He'd got a taxi home to get a drink. These are the issues that ED staff have to deal with.
John Blair.
Mr. Speaker, on the subject of winter preparedness referenced by the Minister, can I ask the Minister if health workers on the ground and professional bodies such as RCN, BMA and the Royal College of Emergency Medicine will be consulted in future when the Minister starts work on his so-called blank page for winter pressures?
Mr.
I'm very happy to confirm that they will be. And I think, to be fair to departmental officials, they were very professional in their approach when they started last March to plan for this winter. However, looking at the plans, it is clear to me that some of these organisations were represented directly at the table, some were represented second-hand by a broader organisational group, and some perhaps weren't even at the table at all. So my view is that we get every single stakeholder around the table for the initial meeting, where the page is blank, and I have some ideas, but then if I start saying that, I'm filling the page in before they get to do their input. So let's start with a blank page. It may be that when we fill it in, a lot of the stuff we already know is bound to go in there. But let's try and be imaginative, and above all, let's include everybody right from the get-go. And that clearly didn't happen this time, which is not a criticism of the department, but it's a critique of what happened last time and how we might improve it this time.
All Chambers.
Question.
Minister.
For a number of years, the department is working collaboratively with the trusts and other stakeholders in an effort to stabilise that social workforce. It's been a key focus of both my predecessor and of myself. In early 2023, there were over 200 social workers employed by recruitment agencies. They were delivering HSC services. The majority of these agency social workers were located in children's services, and that's a sector which was also experiencing high levels of vacancies. So the Department, in collaboration with the Trusts, took the decision to end agency usage for HSC social workers by the end of June of 2023. 160 former recruitment agency social workers were then recruited into HSC posts. I repeat, 160. Since September of 2023 to the present day, the 5 trusts have confirmed to the Department that there were no recruitment agency social workers employed in HSC services. I'm pleased to report between July and October of 2023, 204 newly qualified social workers were appointed to vacant posts. The majority were in services relating to children and to families. This exercise was repeated in the summer of 2024. Again, I'm glad to report a further 221 newly qualified social workers successfully completed their social work training and have taken up permanent employment in the trusts. The net effect by the Department, stakeholders and HSC trusts working together over the past 2 years has been the Trust's complete cessation of agency social work usage, the direct recruitment of 160 former agency social workers into HSC contracts, and the recruitment of almost 430 newly qualified social workers into HSC vacancies.
We've no time for your supplementary, Mr. Chambers. We'll move to topical questions and Colm McGrath.
I wish to discuss our ambulance service, which is staffed by a band of dedicated and skilled personnel who are lifesavers in our community. Would the Minister agree that it was deplorable that at one point over the Christmas period, 41 of 49 available ambulances across Northern Ireland were outside a hospital emergency department, with some waiting up to 9 hours before they were able to pass on their patient?
I thank the member for his point. I think it is entirely regrettable that this is one of the symptoms of the blockage in the flow through our acute hospitals, and it is something I am determined to try and address. The answer isn't simply in more staff or more ambulances. The answer is not just in bigger EDs with more staff in ED. It's not about more beds in acute hospitals. It's about the whole flow, and as the member knows, the biggest obstacle this winter has been lack of community care, whether that be care homes or domiciliary packages. So we have to work hard on that. But I would say to the member, like nurses, like doctors in EDs, like allied health professionals in EDs, ambulance crews did not sign up to sit with often an elderly patient in their vehicle outside an emergency department, potentially overnight. But things are being done to try and improve the service. The member will be aware of the Regional Control Centre at Knockbracken. I visited it a few weeks ago for their daily 12 o'clock call, where they try and coordinate between the trusts. And there's collaboration building, and what they need, what the trusts need, is trust within each other, because you don't want one trust saying, well, we will take some of your patients and take some of the load off you, unless they can be absolutely confident that that other trust isn't simply saying, well, we don't need to try any harder because we can just rely on our colleagues across the trust borderline. So it's quite stark to sit and look at the screens in that regional control centre. Ambulance waiting 12, 14, 16 hours. And often the patient is in their 70s, 80s, or even their 90s.
Mr. McGrath.
Politely, Minister, that's not good enough, because the majority of what you said there was a regurgitation of the problem, and the identified issue that you're saying is the flow. And I think the issue of flow is going to take a considerable amount of time to resolve, but we need to sort out the problem with ambulance handovers now, because otherwise we're going to deprive people in our communities of a 999 call. There's going to be no ambulance for them, which would be totally unacceptable. What can we do now to fix the problem of ambulance handovers?
Minister.
Well, with respect, Mr. Speaker, that comment from the member is entirely inconsistent. Because on the one hand, he's saying this is a long-term problem that needs a long-term solution, and on the other hand, he's thumping the desk and saying do something now. Does the member really think if there was a lever I could pull that would help, even in a minor way, today and tomorrow, that I wouldn't pull it? Does he really think that anybody is sitting back and saying there is a partial solution today and tomorrow that will make a partial positive difference, and we're not doing it? Well, if the member does think that, come and see me after this and tell me what it is.
John Stewart.
Thank you, Mr. Speaker. Previously, the Minister joined me in a very useful and informative visit to a GP practice in Carrickfergus. During the visit, the Minister indicated that the East Antrim GP Federation was likely going to be included in the next tranche of MDT rollout. Is the Minister hopeful that the funding will shortly be made available to allow that rollout to continue?
Minister.
Well, I thank the member. Yes, I very much enjoyed my visit to that practice in East Antrim with the member. Sometimes you walk into a health or social care facility and you're immediately hit with a positive energy and a good feel, and that was certainly the case that day. Multidisciplinary teams are currently in 7 of our 17 GP federations. I would absolutely, if I could click my fingers, or if I had a magic wand, it'd be in all 17 by close of business today. Unfortunately, that is not the case. So East Antrim is certainly far from in the worst position of the remaining GP federations, in that it is third on our list for a rollout. But that rollout is dependent on securing funding from the Transformation Fund. The Transformation Fund has not yet come to any of its conclusions. The Interim Board has done the first sift, and I'm glad to say that our bid for money for multidisciplinary teams is through round 1 into round 2. I can only hope that we will come through successfully at the conclusion of their deliberations, and that will happen as quickly as possible.
Mr. Stewart.
Thank you, Mr. Speaker. I thank the Minister for that quite reassuring update. Minister, how transformative do you believe the rollout will be in areas such as East Antrim, which are experiencing high levels of ongoing health need? And do you hope that by placing more staff in primary care settings, it will ultimately lessen the pressures on secondary care?
Thank the member. To take the second part first, yes, my view is that we must shift left, as I've said, into primary and community care. We must talk about prevention and early intervention rather than waiting people to become acutely ill and ending up in our major hospitals. I think of all the reforms that have happened since Bengoa, when we talk about elective overnight stay centres, day procedure centres, mega clinics, rapid diagnostic centres. These are all in secondary care. Multidisciplinary teams, which of course are in primary care, are probably the most successful example of transformation. And to give the member some statistics, multidisciplinary teams have seen over 751,000 patients offering physiotherapy, social work, mental health and the rest. That's across 116 GP surgeries. 171,000 people have access for full multidisciplinary team services, and 300,000 additional consultations have taken place because of multidisciplinary teams. So my concern is this: in some areas you have access to a full MDT team, in some areas it's a partial one, and some areas not at all. And in terms of trying to deliver health equity, that is an issue, and it's one that can only be addressed through additional funding such as that coming out of that Transformation Fund.
Question 3 is withdrawn. I call Donnelly.
Thank you, Mr. Speaker. I'd like to ask the Minister what impact will the proposed increase in national insurance contributions have on our community pharmacies in Northern Ireland?
I thank the member for his question, and that is certainly an issue that exercises me, as I'm sure it does exercise community pharmacists, because I am not sure that I have any confidence that the government in London is going to step up to the mark and provide any help. So we have, for direct employees of health and social care, I think we will get assistance in terms of that additional demand for national insurance. But in terms of like GP surgeries, community pharmacies, hospices, I have absolutely no confidence that that is coming. And the cost is going to be in the tens of millions of pounds. So this is another very unwelcome and additional pressure on major and extremely important areas of HSC delivery.
Donnelly.
Thanks to the Minister for that answer, and certainly I would agree with that. Given that community pharmacies were a key pillar in his winter preparedness plan of last year and likely to be so again this year, can I ask what engagements he's had with the UK Health Secretary on this topic, and what is he doing to support this key sector?
Well, what I've done is I've written actually to Wes Streeting, the Secretary of State for Health and Social Care in London. I've also engaged with our own Finance Minister, Kiva Archibald, to make her aware of the issues, and I know she's making representations to Treasury. But the member may agree with me that the relatively new government in London has done some surprising things since taking power on the 4th of July. And when I say surprising things, I mean not in a good way. And certainly this rise in national insurance contributions and who it's being targeted at certainly is not going to help in healthcare delivery in the short to medium term. And as the member says, community pharmacies have a really important part to play in my desire to shift left, because along with GP surgeries, they provide so many vital services, and increasingly more, such as the sore throat initiative over this winter.
Blair.
Thank you, Mr. Speaker. Can I ask the Minister if he can give us his assessment of the announcement that the Northern Trust is to go out to public consultation on the proposal for the use of body cams for staff?
Well, I think in recent weeks and months, the member will agree with me that we're hearing some very disturbing stories about activities within the curtilage, particularly of emergency departments, threats to staff being high on that list, drug use and abuse being another issue. So as I say, you know, nurses and doctors and EDs are well used to people coming in with alcohol issues, but some of these developments I think are worthy of being defined as developments. So personally, I support a consultation. I would like to know what the public thinks, and I would like to think the public will back what we always recognise is their support for healthcare workers.
Mr. Blair.
Mr. Speaker, I thank the Minister for that answer and recognise, of course, the seriousness of safety of staff and that must be a priority. But can I ask the Minister if he's aware of any work being done currently, during and maybe even before the consultation commenced, to minimise risk for staff, and that work being done with other agencies would be brought into that reply as well?
I thank the member for the question. Yes, I believe that the trusts are giving active consideration to that, obviously working with the PSNI. Another issue that I think it will lend itself to the use of body-worn video is the introduction, which is forthcoming, as a member will know, of the Right Care, Right Person policy by the Police Service of Northern Ireland, which is particular in terms of how the police react to people who have got mental health issues. I have no particular fundamental objection to the policy. My concern, as the Chief Constable and others know, is that we roll it out in a way where we don't create a hiatus, that we don't do it so quickly that the police stop and the health service isn't ready to pick up that gap. So yes, I think we're working with the police in terms of thinking of body-worn video. As former members of the Policing Board, we know the impact of body-worn video in terms of the police's ability to do their job and bring those who are wrongdoers to the right place.
Carl.
Minister, in a question to your predecessor, I asked about hospitalisation due to damp and mould issues. I was told that the department doesn't keep these figures. Minister, any plans to review that policy?
I don't. If the member wants to write to me, I'll certainly give it due consideration.
Thank you, Minister, for that. I will write them on that. And would you accept that the issue of damp and mould is a public health issue and something that requires urgent action from your department, but also legislation around the issue of landlords and other housing issues, which are often left untackled?
I agree it's a public health issue. I have, as a constituency MLA, visited houses which have damp and mould and very, very young children in them. So yeah, of course, but in terms of legislating, I don't think it falls primarily to the Department of Health, but certainly on a personal level and a party level, we would be supportive of the sort of legislation the member suggests.
Mr. Speaker, Minister, can I ask for an update on the UK tobacco and vapes bill?
Yes, I'm very much supportive of the UK tobacco and vapes bill, and I thank the member for his question. And smoking, as you will know, is the #1 preventable cause of death, disability and ill health in the UK. Here in Northern Ireland, it kills 2,000 people every year. So the Assembly agreed to Northern Ireland's inclusion in the previous tobacco and vapes bill under the previous government. That fell with the election back in July. I hope members will continue their support for the new bill, which is largely the same but with a few extra protections. And I am hopeful that a legislative consent motion will be laid before the Assembly in a fortnight's time. Subject to necessary approvals, the Department will focus in the immediate term in the introduction of this legislation, including bringing forward regulations under the powers in the bill, and will then identify the remaining challenges which will be the focus of a new tobacco control strategy for Northern Ireland.
That draws to a conclusion. Questions to the Minister for Health. If members would take their ease, and we'll move back to the previous debate.